I'd like to share how I interpret a CT brain. I believe interpretation of radiology study needs to follow a set of steps to ensure accuracy. So I usually start with axial set of images in the brain window. I start from the top of the brain, make sure there's no iso-dense subdural hematomas, make sure the sulci are closely abutting the inner table of the covariant. Then I go inferiorly to look for any asymmetry like mass or infarcts and hemorrhage. And also I look at the ventricles, make sure they're not dilated in the setting of hydrocephalus. The next set of important image I usually look at are the coronal images. Small subdural hematomas that are hard to see on axial orientation images can be seen on the coronal studies, like the hematoma along cerebellar tentorium. And also small infarct along the superior aspect of the cerebellum can also be seen on the coronal images much better. In general, having orthogonal correlation really improves your accuracy because it gives the brain a three-dimensional view of the object. And if you have time, I would suggest that you look at the sagittal reformats as well, because you can look at the anterior aspect of the temporal lobe much better. You can look at the lateral aspect of it, and also you can look at the midbrain structures. And finally, I will look at the extracranial structures, the bones and soft tissues. In setting of trauma, we look for fractures, obviously, and we also look at the sinuses, because a lot of times when patients present to the ER with headache, sinusitis is actually the main cause of their symptoms. I look at the soft tissues and see if there's any scalp laceration or hematoma. And the orbits is intact. And that's pretty much it. And that is the CT brain in about 2 minutes.